Hi, welcome to Beyond the Steps. Today we are talking with Dr. Fred Vaziri. Welcome.
Thank you.
He's actually one of our clients. I'm going to let you go ahead and give us your background.
So yes, my background, I studied nutrition science. I went to UC Davis, studied nutrition science, physiological chemistry. I've been in practice for over 30 years. I'm a Doctor of Chiropractic. Also, I studied Chinese medicine. Initially, I wanted to do preventive medicine. So I was looking at different avenues for that, and I decided to go the alternative medicine route. And I've been in practice since 1989, so it's been a long time. And I've done a lot of work with combining Eastern medicine, Western medicine, nutrition specifically, doing some functional medicine. And so since 2012, our focus has been really on weight loss and obesity and all the medical issues and problems that are associated with being overweight, which is actually one of the symptoms of what the problem is. The obesity itself is not. It's one of the symptoms like type 2 diabetes, cardiovascular, nutritional infertility, PCOS. All of those things, those symptoms,
they're all
part of the same.
Correct.
What we call hyperinsulinemia or insulin resistance, which is a hormonal imbalance in the body.
And that's what your practice focuses on. It's helping people lose weight.
Exactly.
And how is it non-traditional? I mean, we focus on you know what I'm asking.
It's like I do consults with patients to qualify them to get on our protocol, and this is one of the things they always ask me. Do you have any? Are you going to give me something to suppress my appetite? The magic pill to make me lose weight? I said there's no magic pill.
Right.
We have passive and active weight loss.
Yes.
Okay.
Yes.
And once you're obese, overweight, you haven't been overweight or obese for 6 months. It's usually 10, 12, 20, 30 years.
You've been fighting that for a long time.
Yeah, you've been fighting it, and before you even know it, you become hyperinsulinemic or insulin resistance, and then that sets off your whole the rest of your life. So
when people say I have a slow metabolism.
A slow metabolism, right? Yeah.
That's always
right.
Yeah.
And obesity is a disease of excess fat accumulation that's caused by hormonal and metabolic imbalances, basically. So your body's storing more and more fat where it's not really supposed to. And once you store the fat, it doesn't come back out. It's those, the storage units.
Your body's supposed to store the fat.
You're supposed to store the fat. And that's, weight gain, and I talk about this all the time. Weight gain is natural. It's normal for somebody to gain weight, and it's calorie dependent. How many calories you eat. If you don't burn the excess calories, you're going to store it. It's like taking a gas tank with you in your car, and you keep putting gas. Every gas station you go, you have to put it back, put it in the trunk. So if you don't burn it. But weight loss is science. And it's nutrition science. It's not drug science.
Yes.
Because that's drug science. That's passive. Taking medication, surgeries, procedures. Invasive procedures.
And we talked about how passive is not a long-term plan.
Right.
Yeah.
Right. And passive, you don't. I don't want to call it a lazy man's way out, but it's a way where you're giving something to somebody and they're not responsible for it. They lose up to a certain point, and all of those have some side effects.
Yes.
Doesn't matter what you do. And they always tell you got to do it with the diet. So if you're taking a 500 calorie diet, but you're taking something else to suppress the appetite, then it's the diet that's making you lose weight. It's not the appetite suppression.
In the end, it's the diet.
Right, it's a diet.
So why not just go to the diet first?
Right. So it's like, and then at some point, people, if they don't learn anything, they plateau, and or they say my metabolism, I got used to it, my metabolism, and your metabolism cannot get used to weight loss, fat loss. When I'm talking about weight loss, it's fat loss.
So then you use the active approach.
Active approach, which is proper diet, and all done by changing certain macronutrients like your proteins, your carbs, your fats, and creating a program where they can eat plus their micros, which are your vitamins, minerals, omegas, and all of that stuff. They have to work in combination in order for somebody to be able to lose weight and do it healthy. Because if you need to lose 150 pounds, you can't be, not healthy and suppress your appetite and
I think that's where I kind of want to go into that. This kind of blow people's minds. But first, before we go into the success stories, because some of them I can't even believe. But I do want to highlight how you, per person, per patient, you take a look at them on paper, in person, and you fine tune their macros and micros. And I think that's the hardest part in today's app world. You have these different apps and you're tracking. Right. But as a dietitian, I know that I'm like, wait, what did you say the percentage was on your fats there? I don't think that's, it's never accurate. You take that responsibility away from the person so they don't have to worry about it or even veer down the wrong path.
We don't even have them count calories. No calorie count, no carb count, no fat count, nothing. I don't even want them to really do heavy exercise. So
I'm sorry, can you say that again?
It's a couch potatoes diet.
But no potatoes for you.
No potatoes for you, yeah. So no, I don't even want to I don't want them to count calories. I want them to focus on the system, on the program versus on the goal, which is, I want to lose 50 pounds. So I need to lose 100 pounds. Because when they focus on that, we go to the next level, which is the maintenance. They learn how to eat and change their lifestyle in order to maintain their weight loss. So that's where the difference is, because it's very difficult to try to figure out a little bit of a carb here, a little bit of protein there. How much am I having? Because you get so much information out there, and you start to look, and everyone is talking in your ear. Do this, do that, do this.
And I think too, with that, the active and passive comparison is, when you do take that pill or whichever way you go, that's not an active rodent, you plateau. Right. And there's a lot of regression. Right. I think with the active approach, you have to change it up to plateau, because you don't stop losing.
Well, when we're doing, there's no plateau for if you're losing weight, if you're burning fat, there should not be a plateau.
Right, and so you have to change the diet. So
you have to change them and get them off the program. One of the things. I mean, there's a lot of studies. I read a lot of the studies that come out. The Obesity Society has a lot of science looking at all of these. The Obesity Medicine Association, all of these, American Nutrition Association. There are a lot of studies that study plateau. Adaptive metabolism, so adaptation to a diet, why people plateau. It's really, if you look at it scientifically, you shouldn't, as long as you have a metabolism, and everyone's looking at metabolism as how fast and slow my metabolism is.
But I don't think I think the word metabolism is used way too freely for everybody. 100%. Metabolic science is not just applicable. Mine's high, mine's low. It doesn't work that way. And again, like you said earlier,
how fast am I driving? Yeah,
exactly.
It's not that. Yeah.
But then segue, my favorite word, into some of the success stories.
So we've had many. Oh my gosh! So
I think. Go ahead.
Yeah. So I'll start from most recent. So in one of my offices, we have office in Laguna Hills, and last week I was there. A couple of weeks ago, one of my patients came in, and she's 61 years old, and she's been overweight for many years. And so she came in, and she has lost 107 pounds in 11 months. 107 pounds. So once she did that, they found that she had a massive, a tumor in her back, the size of a cantaloupe. She came in and she says, "Thank God I lost the weight." And she's petite. She's 5 feet tall, and she was over 200 pounds. Then, so they found it, they took it out, and she was so excited, so happy about that. I have another one that also in my Laguna office, he had a, he told us initially, but it wasn't, a part of anything because, diet related or anything. But he came in, he lost, in the first 3 months, he had lost 35 some pounds, and he had a inoperable brain tumor which would grow every year, so he would get scanned on a yearly basis, and they couldn't take it out because it was on his ear and on the nerve and if they had, it could have caused him to lose his hearing. And for the first time he came in, he's lost 75 pounds now in 6 months. So he stayed on the protocol.
Oh, that's over 10 pounds a month.
Yeah, and for the first time, his tumor has shrunk by a millimeter instead of increasing. So his doctors at L.AC, he said they all got together and figure out what was going on, what did you do differently. So he was telling him about, I'm doing this diet and all that. So I mean, it's possible that the diet was, I like to think that that's what it was, but yeah,
putting it on the website.
Yeah. So there are a number of patients. I've had someone that she was also a nurse, and she found out after she lost the weight, she found out because of palpation that she had breast cancer. So they took care of that.
Where she couldn't.
Right.
Yeah.
So these are a lot of that's just the medical success stories. I've had a lot of patients that have had infertility issues, and I tell them, you come in, I put you on the protocol, you can get pregnant like that.
I think we talked about this.
Right, and they've gone through IVF because they gained weight because of the IVF, multiple IVF procedures and all that. So as soon as we put them on, like 6 weeks later, they're pregnant. And it's not necessarily that, but there's a nutritional infertility, which I think George Wade had done studies on this a long time ago, and it showed that what's called oxidizable fuel, you have 3 different categories how your body uses the fuel that you eat from your food. One is for your physiological function that keeps you alive, so you cannot skip. The other one, the second one, is for your mobilization, moving around, and also for thermogenesis, for your body's temperature. Third is fertility and fat storage. So you can stop reproducing or don't store fat. That doesn't do anything to you.
Well, and from being a woman, the different stages, depending on your weight in the different stages of your life, childbearing, weight has a huge effect on your hormone balance.
Yeah.
Huge. And just in dietetic practice, women who have come in and lost weight when they're trying to get pregnant seem to get pregnant faster.
Right, because it's your body says, okay, now I can support life. So boom, you get pregnant. Then we have to take them off the diet. One of my staff, that's what happened to her. She was, she couldn't get pregnant. She kept getting miscarried, and she was 27, 28. And once we put her on the protocol, she lost about 40 pounds, 50 pounds within like 4 months. She became pregnant. So I took her off the protocol, but she was kind of following the diet, eating very healthy and all that. And her doctors were always saying, because she was over 200 pounds, 240 pounds for 8, 9. Okay. And she had swollen ankles and stuff, but on her pregnancy, none of that. And they asked her, what are you doing? How come you don't have, this? How come you don't have that? She says,
and she didn't get gestational diabetes?
None at all. And her father died of diabetes at 45, age 45, and all her family have diabetes. Yeah, there's a lot of issues there. So after she had her baby, she came back on protocol, and she's already lost 60 pounds in a matter of like 5 months. And
she's been healthy for her child.
And a lot of those things are, you have to understand what you're doing. So metabolism is not just how fast or slow. Your metabolism is everything your body does with your food, what you eat. So it's so complicated. It's not just
it's very complicated. I remember having to draw in detail the Krebs cycle just for undergrad.
Oh my gosh, yeah. When I did my final exam in physiological chemistry, they give us 6 hours to do it. From 6 in the afternoon till 12 midnight to 12 o'clock, because we had to you take this. What happens to your
and
liver?
This transporter.
So that's metabolism. So when you're looking at it as fast or slow, you're missing the whole point.
Yeah, it's not black or white at all whatsoever. Yeah. I think that can kind of move us into non-essential versus essential in this restriction, because if you're not. You're eating this amount of calories and you go down to this amount of calories. What are you missing? And that's kind of how you came to us in trying to fill that gap. And
right. Yeah, it's really important making sure, because when your body can support itself by the fat it's storing for a long time, as long as you have that stored. But if you're eating less, trying to lose weight, you're gonna miss out on a lot of micros, vitamins, minerals, electrolytes, things like that. So all of that stuff you have to supplement that. Okay. So that's what we do with our program, and with Leaf was really effective and helpful in creating things for our dieters.
We started with your BCAAs.
BCAA, yeah.
So just so that our audience, which they probably already know, but you have your non-essential nutrients, you have your essential nutrients.
Right.
What we're helping you do is fill that, in reducing the amount of calories that you're intaking, we're helping you fill that void of the essential nutrients that you have to get from your diet.
So you got your carbs, you got your carbs, your macros, your carbs, your fats, and your proteins. So proteins and fats are essential. So you need to get some part of it from your diet. Your carbs, you don't. When you think about it, your body, when you go into a proper diet, which is a nutritional ketosis, you're actually creating two different fuel. Your body, you're getting ketones, so your liver is making ketones, and you're releasing a lot of fatty acids into the circulation. So you're getting that fuel, but you're also creating. You're going into gluconeogenesis, which is making glucose. So that glucose that your liver is creating and making is for your brain function, is for your red blood cells that don't have mitochondria, so they need the glucose from that. So carbs are not essential.
Because we make them.
We make them.
We make them,
yeah. So when they say, you need 130 grams of carb for your brain, it's not because you need 130 grams. It's because your brain uses 130 grams of carbs. But if you're making it, so you're getting it for it, then you don't need it. So
hence why we started with BCAAs.
And that's why we did. And then the other part of it is when you're starting off a diet, for the first 2 to 6 weeks, your body is adapting to go into ketosis and gluconeogenesis. So you tend to want to burn a lot of protein, muscle mass to get that energy initially.
Because it's easier for your body to do it that way. And do you see that in those first 2 to 6 weeks that your patients get flu-like symptoms?
Our patients don't.
What?
Yeah, because of BCAA.
Touche.
So we created the BCAA specifically. It's not just branched chain. If you look at the BCAAs on the market, it's all, you got valine, isoleucine, and leucine in the different compositions. So we put other stuff in there. So we have alanine, beta-alanine, glutamine. We have biotin. So biotin is your first vitamin that it's used up in gluconeogenesis cycle in the liver. So we put biotin, and by the way, you talk to dieters, they lose hair and they take biotin. So it could be that, I don't know. There's studies, but they're not conclusive that it's biotin that's causing that. But if it is, biotin is there, but it's also helping with gluconeogenesis. So the biotin's in there. And
it tastes really good.
Yeah, it tastes really good. We did that taste test.
Taste test.
Yeah, that was here. That, by the way, that's what I like to do. I like to sit there with the scientists right there and tell, she went back to the lab, she came back and said, try this, try that. And
and I think that's part of the reason why you chose to go with Leaf, because of that 2-month period when we were in production.
Right. Yeah, it was so fast, and it was really, the first time we did that with another company, I don't want to name, but took us almost 2 years, like a year and a half, sending it back and sending us this flavor, that flavor, and it was very costly trying to do that, and our if for me, when I'm reading studies and I want to create something, it's really important to sit there across this table from the scientists and say, this is what I want, that's what I want, what do you think of this? So I bring them that, and then they put it to,
bring it to life.
To bring it to life, kind of like what I do with my patients. They come in and they tell me, this is what I need to do, this is where I am. So I say, okay, this is what you need to do. So we partner up with our patients, same way we partner up with our lab. So come together and help.
Yeah, I remember that day. I love it. And you guys were there. The lab coats were there. Everybody was there, and we were trying everything. And then I touched base with Sarah, your sales rep, within I think like 3 weeks later, and she's like, no, it's on the line.
Yeah, and we had the who I can't remember her name. She came in multiple times, and she was kind of creating the
Laura.
Was it Laura? Yeah.
Mm-hmm.
She was fantastic. She came in with this flavor, that flavor, that changed the color a little bit based on what was in it and all that stuff. So that was really helpful. So by the way, I have another product that I want to work with them to create. and that goes, and that's and that's we're talking about now. With the all the drugs that are coming out. Not coming out now, but they're using them for a different thing for the GLP-1 agonists and things like that.
That has me a little worried.
It definitely worries some, but guess what? You can do the same thing with diet.
Right. 100%.
Yeah, your GLP, you can be, GLP goes up, and so I'm not knocking the medication. The medication is definitely necessary, but we used to get people off of the Ozempic on the diet.
Right, and I find that using everything in conjunction.
Yeah.
And then if it's not needed anymore, it's not needed anymore.
Right.
It's like patients who have a very painful condition and they're on pain pills for however many years, and then they change their diet and they start doing yoga or Pilates, and they strengthen their pelvic floor, and they don't have to take those pills. Right. Everything is a progression. It never stops.
That's part of it. And then you have those patients that they've already progressed so far out that they need knee replacement, but they're too heavy to have surgery. So we get them, ready for their surgery. Let's talk about that too. Yeah.
The reasons people come to you. I know we had a whole list. People don't just come to you just purely to lose weight, but they come to you before surgery. They come to you.
Right. Yeah, because we've had a lot of these patients that, I've been in practice so long, and people know us in the community. And so they hear, I went to Dr. V prior to my surgery, so I needed to have knee replacement. Their doctor knows us, and they send them over to do that. And by the way, the reason it's really cool is because typically our average patient weight loss is 8 to 10 pounds a month. Mm-hmm. So 8 to 10 pounds a month of losing body fat, about 90% through diet only, and there's no plateau. So it depends how much you need to lose. That's how long you need to be on the program.
And commitment. They've got to commit.
Yeah. So you got to commit, but we tell them you become your own nutritionist, basically, because now you're learning what the foods do, how you don't need a ton of food.
Well, they build I think where, specifically in the United States, we don't have a positive relationship with food. Mm-hmm. We constantly think that it's harmful because we're just eating calories, and then you try to restrict, so rebuilding that relationship and making it positive, I think, is really what you're doing.
Right.
What communities are you in?
Mainly like the Persian community. So what do you mean?
The location.
Community.
We can go that way too. Yeah. It's fine.
Wherever the Persians are. Wherever. No, we're in locally Woodland Hills and Glendale area and Laguna Hills, and we're looking in up north San Francisco, San Jose, because we have people that fly down to see us down here, or we do Zoom calls with them. But that's where we
And that's since you said about 2012.
For the weight loss, yeah. But in total practice, over 30 years. Yeah. So, but the other thing I was going to touch on was the supplements, vitamins, minerals, and we work with you guys on. I've had so many times that people come in and say, I didn't lose the way I wanted to. I didn't lose, or they come in and say, I take my vitamins. Isn't that enough? But I'm not eating my food. Vitamin is not food. No.
That's a big misconception. Is that they can supplement.
Right. So with your macros and micros, it's kind of like I explained to the patients. It's like if you have a factory that's making cars. So you bring the parts into the factory, and the people that are putting them together and assembly. So the parts are your macros and micros. Mm-hmm. The workers are your vitamins and minerals to put them together.
Right.
So if you don't have,
you have a factory full of workers. Like, where's the parts to put together?
So you guys are like our staffing agency for the workers, the vitamins and minerals.
We interview them for you.
So we bring those in, and we bring in the other parts. We help the patients bring in the carbs and the fats and the macronutrients and stuff. So we put them together, helping them understand they have to work together in order to become healthy. It's not just to lose the fat.
So you help them with the diet, and then we've come in as your staffing agency on the side to give them those essentials that they need, they might not be getting. Yeah, and I think you touched on something kind of cool when people would come in and tell me that they have all these supplements, they're taking all these supplements, and everyone has a condition, right? Everyone has something that they're trying to heal. I'm like, well, that could actually be exacerbating your issue, right? So when you come in with the nutrition science, and then here, let's relegate it to these supplements, let's start here. It's really helpful for people because it's overwhelming.
As you know, as a dietitian, nutrition and food is your foundation. That's it. If that's not there, nothing is going to work. If you're constantly eating a lot of sugar and a lot of carbs and a lot of that, no matter how much insulin you're getting from outside, it's not going to really help you. So you have to fix that first. So the reason we focus mainly on weight loss and it's called weight and pain management is because a lot of the pain was coming from the weight and the inflammation and the visceral fat and the fatty liver and all that stuff that creates and causes different hormonal changes. Visceral fat versus subcutaneous fat, they're different.
We can get into a whole conversation on that. Well, we got to wrap in 2 minutes.
I know. So I mean, I can sit here and talk to you for 3 hours.
But I think what's more important is this was very interesting. Also, I think very enlightening for people coming into this space like I am. I'm committed to losing this weight, but not understanding that you can't just use the word slow or fast metabolism. So let people know where they can find you, how they can find you, and then let's go downstairs and develop another product.
Well, they can always look us up on Doctor Doctor Vaziri Vaziri.com.
Cool.
Yeah, that's our website, and everything's on there.
All your links on there.
All the links are on there. The information.
And TikTok.
And by the way, for locally, for people that are around here, I always do an initial consultation with them without charge, because I want them to understand what, if they want to lose weight, what it's going to take. We don't bring anybody in without that understanding, and if they're on medications and things like that, then we need to work with their physician to make sure that when they're on protocol, because a lot of those meds tend to either reduce
speed things up or slow.
Especially diabetes or blood pressure medications, they normally they're off of them or they're reduced significantly.
That's amazing. Well, thank you. Thank you for being on. And
that was awesome.
Go find Dr. Vaziri on his website, on his links, etc. And thank you for watching Beyond the Steps.
Thanks.
Thank you.